My name is Christy and I work as a sonographer. My typical duties are I scan 8 to 10 patients a day. We do all types of ultrasounds ranging from abdomens, venous Dopplers, gallbladders, aortas, carotids, OB. We do a lot of OB patients. The first thing that we do when a patient comes in is we have them lie down on the bed and we obtain a bare belly, just have them lift up their shirt a little. We apply some acoustic gel on their stomachs, and we take the little cameras which are called ultrasound probes, and we scan along the rib cages and look at the different types of organs. We're looking for any type of pathology, any kind of cysts, tumors, masses, anything that's out of place. And it usually average exam would usually take about 10 minutes, and then we wipe them off and send them on their way. We, like I said, do 8 to 10, maybe even 12 patients a day, all different types of exams. My hours are usually 8 hours a day. Sometimes there's a little bit of overtime. We do cover call, which is after hours. You can get called in at 2 or 3, 4 o'clock in the morning and still have to get up and work the whole next day. You do get paid time and a half for that, of course, because it is on your own time. It's a very rewarding career. You do get to help the patients. It's not like you're an EMT and saving any lives, but you are helping diagnose patients' pain, are helping stage cancers. In order to become a sonographer, there are 2 ways that you can go about this, depending on what school is located in your area. One is you have to have a 2-year college degree before you would get accepted into an accredited ultrasound program. The other way, some community colleges are offering a 2-year degree where you would take your general education course requirements along with sonography requirements to obtain your Associate of Science degree. Depending on which one you choose, there will be clinical internships or clinical rotations. And from graduation of one of those schools, you will receive your diagnostic medical sonographer certificate. After your certificate, you get your certificate, then you would be eligible, depending again what school you went to, you would be eligible to sit for the national registries, which is the ARDMS. There are 6 to 7 different types of specialties. Breast is another one. There are many different specialties that you can take a specialty certification in. The skills needed to become a sonographer are definitely multitask, excellent patient care skills, patient quality, patient empathy, ambidextrous, because you're going to have to run the machine with one hand and scan with the other. I love my job. I've been working as a sonographer for 16 years this month. The best parts of the job is that I get to take care of patients. I help the patients. I help the doctors learn their diagnoses. I help them with pain control. That's the most rewarding part of my job, is just to be able to help the patients and to know that I help the patients. The worst part of my job is that there are some things that a lot of people are not aware of, more like if you're sensitive to smells or drainage procedures. We do indigent patients. There are patients that will throw up on you. Some are combative. They'll bite, scratch, kick. You just have to be eligible to handle patients like that, and that's just something that's learned with experience. We do drainage procedures and we do biopsies, so you have to be okay with the sight of blood. Not that it's really gory, it's not that bad at all. Pretty much you just run the machine and help take care of the patient while the radiologist comes in and performs the procedure. But if you have the sight of blood scares you or smells, then this is definitely something you will have to get used to. My advice for someone interested in this line of work is it is very, very rewarding. You need to make sure that you keep your GPA up, take as many classes as you can with an emphasis in science, study physics and anatomy and physiology. Those are the two, three biggest things that a lot of people don't expect, that you absolutely have to have a good knowledge base on.